In the dim glow of the hospital monitor, I sit, fingers poised over the keyboard, my gaze flickering between the screen and the patient's weary face. The electronic medical record, EMR, a digital labyrinth of patient histories, lab results, and treatment plans, has become both my ally and my adversary. They say progress marches forward, but sometimes it tramples over the very souls who strive to heal. The EMR, once hailed as a beacon of efficiency, now casts a shadow over our hearts. We, the healers, are shackled by its demands, our compassion buried beneath layers of checkboxes and drop-down menus. Each day, I navigate this digital maze. I click, type, and scroll, documenting symptoms, medications, and allergies. I chase after elusive data points, racing against time and the relentless tide of patients. The screen glows, and I wonder, when did medicine become a data entry marathon? The EMR whispers promises of streamlined care, but it forgets the human touch, the warmth of a hand on an elderly person nearing the end of their life, the reassurance in a doctor's eyes. It cannot capture the tremor in a nurse's voice as she cares for a gravely ill child, or the silent prayers of a surgeon before a life-altering incision. And so, we carry the burden. We shoulder the weight of pixels and protocols, sacrificing moments that could have been spent listening, comforting, connecting. Our days stretch into nights, and still, the EMR demands more. It insists on checkboxes for empathy, drop-down menus for compassion. I think of my colleagues, the nurses who juggle medications like magicians, the technicians who coax life from machines, the janitors who mop away tears and blood. They, too, bear this load. Their hands, once tender, now click and swipe, their hearts yearning for the simplicity of paper charts and face-to-face conversations. We are healers, not data processors. Our purpose lies beyond the sterile glow of screens. We long for the days when healing flowed freely, unencumbered by endless digital chains. Perhaps one day the EMR will evolve, a partner rather than a taskmaster. Until then, we persist, our hearts beating in sync with the rhythm of keystrokes, hoping that somewhere in the code, our humanity remains intact. And so I type, I document. But in the quiet moments, I remember, we are more than checkboxes and drop-down menus. We are healers, burdened yet unyielding, navigating the labyrinth of medicine, seeking solace in the spaces between the lines of code.